Yan kay Senate Committee Chairperson on Health and Demography, Senator Bongo. Dagdag pa niya na hindi delayed o nahuhuli ang National Vaccination Program ng pamahalaan. Ang detalye sa report na ito.
Parating ng mga karagdagang COVID-19 vaccine na pupuno sa supply para mabakunahan ang nasa 1.7 million na medical frontliners. Sinabi ni Senate Committee on Health Chairperson Christopher Bongo. Darating na sa bansa ang karagdagang 400,000 CoronaVac ng Sinovac mula China, nakabilang sa naunang 600,000 vaccines na donasyon nila sa Pilipinas. Bago matapos ang Marso, inaasahan na rin niya ang 1,000,000 CoronaVac na siya namang binili ng Pilipinas at China. Dagdag ni Go, nakapila na rin para sa shipment ang 979,200 doses ng AstraZeneca vaccines na karagdagang donasyon naman mula sa COVAX facility. Kapag nagtuloy-tuloy ang pagdating ng mga bakuna ay aabot na sa higit 3.5 million na kayang mabakunahan ang nasa 1.7 million medical frontliners hanggang Hunyo. Kamakailan lang ay binigyan na ng Food and Drug Administration ng Emergency Use Authorization ng Sputnik V ng Gamaleya mula sa Russia. Ayon kay Go, kasalukuyan ang pakikipagnegosasyon ng pamahalaan sa Russian company para sa bibilhing 3 milyong bakunang Sputnik V. Dagdag ni Go, hanggang sa Hunyo, asahan na ang pagdating ng karagdagang bakunang Sputnik V, Sinovac, Moderna, Novavax at AstraZeneca. Pagtitiyak ni Go, walang delay o pagkaantala sa vaccination roadmap ng bansa. Panawagan niya sa mga Pinoy,
as the President said, no one should be left behind in our path towards full recovery. If we remain united, we will heal as one people and we will recover as one nation.
Sa kasalukuyan po ay 4 na COVID-19 vaccines na ang nabigyan ng Food and Drug Administration ng Emergency Use Authorization dito sa Pilipinas. Ang mga bakuna po ng Pfizer, BioNTech, and Oxford AstraZeneca, Sinovac Life Sciences at ang huli ay ang Sputnik V ng Gamaleya Research Institute mula po sa Russia. Para alamin ang development sa mga bakunang ito, makakausap po natin si FDA Director General Yusek Eric Domingo. Doc Eric, good morning po.
Hi, good morning, Yusek Rocky.
Opo. Yes, Yusek, sa naging review po ng FDA para mabigyan ng emergency use authorization ng Sputnik V, ano daw po ang mga known at possible risk sa pag-a-administer po ng bakunang ito sa isang tao at ano po yung common side effect na pwedeng maranasan ng mga tatanggap nito?
Yung Sputnik V na vaccine, Yusek Rocky, para din siya yung AstraZeneca, isa siyang adenoviral vector vaccine. Ibig sabihin, galing po siya sa virus na hindi nagiging sanhi ng sakit sa tao. Tapos dinagyan siya ng genetic material ng COVID-19. Pagkatapos yun ang ini-inject sa atin para mag-elicit ng immune response. Maganda yung kanyang efficacy rate, mahigit 91%. Simula po sa bata hanggang sa matanda, medyo pare-pareho, no? Very consistent yung kanyang efficacy rate. At yung nakita naman po sa kanya ng mga side effects or adverse events ay very similar lang po sa mga regular na mga nararamdaman natin kapag tayo nabakunahan ng flu, katulad po ng mga pananakit sa braso, yun po konting yung iba, meron parang tumatamlay ng konti, may konting sinat, or may konting pagbibigat ng katawan, merong iba na magkakaroon ng parang mild sore throat. At syempre po, ang kailangan lang nating bantayan naman dito talaga yung mga may history din po ng allergies, katulad po ng ibang bakuna.
Yusek, may datos ba o reports na mula sa Gamaleya kung ang Sputnik V daw po ay effective dito sa mga nakikitang bagong variants ng COVID-19?
Well, ongoing pa yung mga studies on the new variant. So, lahat po ng mga vaccines ngayon. Pero ito naman ay mukhang naman pong ang alam naman po natin, habang dumarating ang mga bagong variant, there's a possibility talaga na bababa ng konti ang efficacy ng mga vaccines. At later on, kung nakita naman po ito, maaari naman po kasing i-revise yung mga vaccine para maging mas effective siya with the new virus. So we're still waiting for the data on the new variants.
Ayon po sa report ng The Lancet at ng BBC ay slightly different daw po yung formulation para sa first and second dose ng Sputnik V na gumamit ng magkaibang adenovirus vectors. Mas effective daw po yung ganitong setup para i-boost yung immune system na babakunahan at mas tatagal din daw po yung epekto nito. Totoo po ba daw ito, Dr. Domingo?
So ito yung mga isa sa mga theory kung bakit nga napakataas ng kanyang efficacy rate compared to other adenoviral vaccines na ginagamit. So totoo yun, Yusek Rocky, no? Pag binakunahan ka nung first dose mo, ibang adenoviral vector ang laman noon. Pagkatapos after 3 weeks, babakunahan yung tinatawag nating component 2 or second dose, ibang adenoviral vaccine naman, ibang adenoviral vehicle naman yung ginagamit doon. So ang theory is that since magkaiba
Po kayo, Yusek.
maraming salamat din po.
Opo, vaccine confidence ang isa sa nakikita pong posibleng dahilan ng World Health Organization sa biglang pagdami po ng mga kaso ng COVID-19 na naitatala dito sa bansa araw-araw. Asahan ba natin ang pagsipa pa ng numero ng mga nahahawa sa sakit ngayon? Dumarami rin po ang bakunang dumarating sa Pilipinas. Para pag-usapan yan, we are joined by the WHO representative to the Philippines, Dr. Rabi Abenya-Singh. Good morning, Dr. Rabi.
Good morning, Yusek Rocky. Good to be here.
Dr. Rabi, can you tell us what vaccine confidence means and how it could possibly be the cause of the sudden surge of COVID-19 cases in the Philippines?
it's not vaccine confidence, it's vaccine optimism probably that is responsible to some extent to an increase of COVID cases, not only here in the Philippines, but in other countries also where we are seeing an increase. The interpretation is that with the arrival of vaccines, people started relaxing their protocol compliance, so the public health behaviors. There was a tendency, not largely, but in small measure, to go out more frequently, to meet more frequently with other people. Of course, this was partly because of the long quarantine periods and the long lockdowns that people have undergone. And so with the arrival of vaccines in many countries, there was an optimism that people can go back quickly to the way they lived life before the pandemic. And these little changes in compliance with the protocols is believed to have caused opportunity for the virus to transmit more freely, and that could have been one of the causes why we are seeing increased transmission here in the Philippines also.
Dr. Robbie, has the same scenario been observed in other countries that has started their vaccine rollout?
Yes, so we are seeing right now a global increase in cases. Our Director General mentioned that this on Friday, that last week was the 4th consecutive week. We are seeing a week-on-week increase of the number of cases reported globally. So after a stabilization of transmission in January and early February, we have seen now that globally in several countries we are seeing an increase of transmission. And the thinking is that this could be related to vaccine optimism and the arrival of vaccines, and not following the protocols and the physical distancing as before the vaccines arrived. But it could also be to some extent linked to circulation of new variants that are thought to have increased transmissibility. So the mix of these factors could actually be causing higher levels of transmission in the Philippines also.
Dr. Robbie, now that the FDA gave the green light to the Sputnik V vaccine from Russia, is this vaccine already included to the WHO's emergency use listing? If so, could the Philippines possibly get this from the COVAX facility on top of the AstraZeneca and Pfizer vaccines?
Unfortunately, the Sputnik V vaccine is not part of the WHO EUL process yet. It is a vaccine that is being considered by WHO for EUL listing because of its reported high efficacy, but the process is not yet complete, and so it cannot be included in the COVAX folder of vaccines until WHO grants emergency use listing status for the Sputnik V.
Dr. Robbie, with the issue circulating around the AstraZeneca vaccine that was suspected to have caused blood clotting in many countries in Europe has temporarily suspended its administration, while some continue despite this concern. Although WHO already mentioned that there is no evident link between the vaccine and the blood clot, is the WHO at least conducting further investigation on this matter to ease distrust and discomfort to this vaccine?
So there was some concern that there was a relationship between a few episodes of thromboembolic disease or blood clotting which had been observed in some countries of Europe. But we are happy to state that the European Medical Association, after a careful evaluation of all the data, has agreed with WHO's position that there doesn't seem a causal link with the AstraZeneca vaccine and the frequency of thromboembolic episodes that have been reported in the population. Actually, the number of thromboembolic episodes that have reported in the vaccinated population was, according to some reports, lower than in the normal population. So there is no causal link established, and so we are conscious of the fact that there were about 40 cases of such disease episodes reported in Europe. But this is in comparison to almost 50 million doses of AstraZeneca that have been administered, nearly 20 million in Europe and about 30 million in other parts of the world. And these reports have not been seen anywhere. So based on this fact, WHO and now the European Medical Association reiterates that there is no link and it is safe to use the vaccines. Of course, recognizing that these are emergency use listed vaccines, WHO and the European Medical Association continue to say that national authorities need to monitor carefully for side effects, and we encourage countries using AstraZeneca vaccine to do that. But the current position is that there is no evidence that the vaccines actually are causing those episodes, and therefore the usefulness of using the vaccine far outweigh these few sporadic cases that have been reported to WHO. So while advocating that countries continue to monitor for thromboembolic disease and other side effects, the consensus now is both from WHO and the European Medical Association that the AstraZeneca vaccines are safe for use. And based on this decision that came on Thursday from the EMA and Friday from WHO's Global Vaccine Advisory Committee on Vaccine Safety, many of the European countries that had a temporary halt on the use of AstraZeneca have restarted using them, and the AstraZeneca vaccines are now being used all over the world.
Dr. Rabi, do you agree with the government's move to administer the remaining AstraZeneca vaccine and stock as the first dose for health workers in areas with high cases of COVID-19?
So as the number of cases increase, it becomes critically important that we take steps to reduce that transmission, but also as part of that we ensure that the healthcare capacities are fully functional. Of course, it was with this view that originally the frontline healthcare workers were included in priority group 1, and now that we are seeing a surge of cases in the National Capital Region and adjoining regions, it becomes even more important that we protect the healthcare workers by the use of vaccines. So we are trying to maximize the benefit of the vaccines we have by vaccinating the frontline health workers as quickly as possible, targeting specifically those areas that we are seeing an increase of transmission. We know that with one dose of vaccine, there is protection of over 75%, and so it's important that we provide that protection to the healthcare workers so that they can continue to care for those people who fall sick from COVID in those areas of increased transmission. So this is quite aligned to what WHO, SAGE and WHO has been advocating, and we are happy that the Philippines is following this strategy. Thank you.
Dr. Rabi, what if the additional AstraZeneca vaccine did not arrive as planned in time for the health workers' second dose? Would this affect the efficacy of the vaccine?
The second dose is scheduled to be given after 8 weeks around and could be given up to 12 weeks. The evidence that is available globally shows that the maximum benefit of the second dose can be achieved by administering the dose after the 10th week and around the 12th week. So we believe that new stocks of AstraZeneca vaccine will arrive before the 12th week. 12 weeks from the arrival of vaccines on the 4th of March will be in June, and we believe that the country will receive further stocks of AstraZeneca before that, so that we can ensure that all those people, healthcare workers who receive the first dose, will be able to get their second dose before the 12th week or around that time.
Dr. Rabi, let's now proceed to the question from the media. We have here from Laila Salaveria, what does the WHO think of proposals to exclude PVT entities such as those in the manufacture of tobacco, alcohol, milk, and soda from procuring their own COVID vaccines? What effect could such a policy, if enforced, have on efforts to immunize the population?
The concern with those sectors procuring and distributing vaccines was that that could be used as advocacy for those products and could be interpreted from that light. So under the Framework Convention for Tobacco Control, which the Philippines has signed, there are limitations on providing opportunities for those industries to be providing health-related services or using health-related services for marketing advocacy. It's in line with this, we believe that the Department of Health does not encourage those industries to be involved in the distribution of vaccines. Of course, their workers will be entitled to vaccines through the national vaccine rollout. And so we don't believe that they will be left behind as the vaccine rollout happens.
We have another questions from Red Mendoza of Manila Times. Former National Task Force Advisor Dr. Tony Liachon criticized your statement in our previous conference where you said that vaccine optimism was the reason why cases have increased in the country, stressing that the ultimate blame for the increase of cases in the country was the slow response of the government. What can you say about this?
Well, the fundamental reason is why are we seeing an increase, and as I mentioned the last time, this increase is not limited to the Philippines. We are seeing an increase in many countries, including in countries that have been rolling out vaccines rather successfully. So it's something larger than the slow response. The slow response could be attributed to increasing cases continuing, but the fundamental reason that actually contributed to an increase in cases is rather more likely to be linked to the factors I already mentioned.
Another question from Red Mendoza, with more than 21,000 cases posted in the past 3 days, is this a cause for alarm for the government to strengthen its response? Do you think the current measures that were imposed on Sunday are enough?
There are two aspects that need to be looked at. Clearly, the compliance with the minimum public health standards need to be reinforced. and those measures that were announced on Sunday will go a long distance to do that. But if we also assume that this transmission is in some way linked to the circulation of new variants who are reported to have increased transmissibility, it becomes increasingly important that at a local government level we expedite the case detection, testing, the contact tracing, the quarantining and isolation of infected people and exposed people, close contacts. This aspect of the response is something that has suffered through the year because, as I've mentioned before, the implementation has been different across different local government units. So this is again an opportunity to reinforce and ensure that those measures are strengthened in addition to the non-pharmaceutical measures or the minimum public health standard that are being strengthened through the resolution of the IATA.
Dr. Rabi, a question from Joseph Morong of GMA News. If you analyze the present situation in the Philippines, what are the areas of improvement in the government's response to the pandemic?
So as I already mentioned, the need to strengthen the rapid testing and strengthening the contact tracing and management, the identification of sources of infection. Where is the transmission actually happening? Is it limited to social gatherings in families or among friends? Is it also being driven by gatherings at work sites, in dormitories? This kind of investigation at local government level is critically important so that we identify those mass amplifying events and do everything possible to minimize the occurrence and the repeat occurrence of such situations. So this is an area that we have not been able to strengthen over the last few months, and maybe this is an opportunity for us to focus on that and identify those settings where we see transmission happening and to share that information with the public so that the public can avoid those places and protect themselves more effectively.
From Sami Danilla of Business Mirror, has the WHO already conducted a study on the P3 variant of COVID-19, which was first detected in the Philippines? If yes, it is more infectious than the usual kind of COVID-19.
So the P3 variant appears to be linked to the P1 variant, which originally was reported from Manaus in Brazil, but with some further mutations. Now the question is the P3 variant associated with increased transmissibility or increased severity of disease? WHO here in the Philippines and in other countries where the P3 variant has been confirmed is working with national authorities, including here in the DOH and the Philippine Genome Center. We are trying to understand the number of confirmed cases of P3 variants, what are their clinical symptoms, how many close contacts of them have been infected, because all this information will help us to come up with a hypothesis whether the P3 variant is actually linked to increased transmissibility or causing more severe disease. So this is an ongoing process. I would like to remind you that the B117 variant, which was originally detected in the UK in September last year, is still being analyzed and we are trying to understand. So this process takes a long time. The P3 variant was confirmed only in early March, late February. So this is going to take a few more weeks or months to understand the epidemiological significance of the P3 variant and whether it is actually linked to increased transmissibility or severity of disease.
Dr. Ravi from Joseph Morong, how soon do you think should the Philippines ramp up a vaccination to stem the rise in COVID cases and to stem the rise in COVID cases? And can the Philippines use Sputnik V for the senior citizens?
So, vaccination is a critical component of the COVID response. We have repeatedly been saying that we want access to vaccines, equitable access to vaccines across the world, and especially more so in countries that are seeing an increase in transmission, because the impact of the vaccines will be far more marked if we can have populations in those places that are seeing increased transmission vaccinated. So in line with this, we are very much supportive of the Philippine government's efforts to access vaccines and provide protection to the population. This is of course in addition to the minimum public health standards that need to be reinforced. What we know is that if we can provide vaccines, particularly to the frontliners and the healthcare workers, we will see a marked decrease in severe COVID and a decrease in deaths. And this is our immediate aim. This is what we need to aim for now as we strengthen the minimum public health standards aimed at reducing transmission. So if we can access vaccines and provide them to the priority groups, we could expect to see that impact early on. So we encourage the Philippines to access vaccines as early as possible, and we certainly are working with the COVAXIN facility to expedite deliveries to the Philippines. With regards to the Sputnik V vaccine and whether they are suitable for elderly populations, I go back to the fact that this vaccine has not been completely evaluated by WHO at this point of time, and therefore I would refrain from commenting on that.
Thank you very much for your time, Dr. Ravi Abengyasing, WHO representative to the Philippines. Thank you very much. Maraming salamat po.
Thank you so much. Have a good day.
Samantala, nasa 1,600 na po nakatao na sa lanta ng mga bagyo noong nakaraang taon sa lalawigan ng Isabela ang binalikan at muling hinatira ng tulong ng pamahalaan at ni Senator Bongo. Kasama rin po yung nasa 500 medical frontliners at mga pasyente sa isang ospital sa probinsya. Narito po ang report.
Sunod-sunod na dagok sa buhay ang naranasan ni Irene Val ng Kawayan, Isabela. Kasagsagan ng COVID-19 pandemic ng mga anak at sa kalagayan niya bilang person with disability, hindi lang sa panganganak na hirapan kundi sa sitwasyon dahil sa virus. Kamakailan lang na aksidente pa ang mister niya na tricycle driver kaya hindi makakabiyahe.
May anak po akong baby, 10 months old po, na naggagatas po siya. Hindi ko po alam kung saan ko kukunin yung panggatas niya, sir, at yung sa araw-araw namin. Tapos, magbayad po namin ng kuryente. Malaki po yung problema namin kasi pinapabayaran po kami ng babae ng 22K. Saan po kami kukuha nun? Mahirap lang po kami. Kahit na po 1,000, mahirap nang hanapin. Lalo na po yun.
Pumunta siya ng City Hall para i-follow up ang kuha ng CCTV sa pag-aksidente ng asawa nang tiyempong namahagi ng ayuda ang tanggapan ni Senador Go at kabilang siya sa nabigyan.
Masaya po kasi hindi ko po akalain na mabibigyan po ako. Kasi ang sadya ko po talaga dito, si Vice Mayor po, kakausapin ko lang po about sa CCTV para malaman po kung ano po yung totoong nangyari sa asawa ko.
Nitong nakaraang linggo, binalikan ni Senador Christopher Bongo ang Ilagan, Isabela para ituloy ang pamamahagi ng ayuda sa mga nabiktima pa ng bagyo at pagbaha noong nakaraang taon. Abot sa 1,600 na mga benepisyaryo ang inabutan nito ng mga pagkain, grocery, vitamins, mask at face shield, sapatos, bike at tablets. Bukod sa Kawayan City, nag-ikot din ang kanyang outreach team sa mga bayan ng Santa Maria, San Pablo at Santo Tomas para mamahagi ng tulong sa mga naapektuhan ng kalamidad.
Nakatanggap po kami ngayon ng 3,000 pesos kasama po yung mga vitamin C, mga face shield, saka face mask. Nagpapasalamat po kami sa Pangulong Duterte, kasama po si Senator Bongo, kasama din po lahat ng staff ni Senator Bongo.
Personal ding binisita ni Senador Go ang Malasakit Center at ang mga medical frontliners sa Governor Faustino D. Sr. Memorial Hospital para pasalamatan sila sa patuloy na paglaban sa COVID-19. Abot sa 500 mga medical frontliners at mga mahihirap na pasyente ang inabutan ng tulong.
Ngayon lang nagkaroon ng ganito na isang napakahalaga, napakalaking bagay para sa ating mga kababayan. Kasi lahat ng mga nagkakasakit na walang-wala, natutulungan niya. No? Kay Senator Bongo, maraming salamat. Siyempre sa ating presidente. No?
Bilang isang frontliner, napakahirap po para sa amin na labanan ang hindi po namin nakikitang sakit. Kaya po kaming mga frontliners ay nagpapasalamat kay Pangulong Rodrigo Duterte para kami prioritize sa vaccine na to. Kami po yung nabakunahan last week ng Sinovac po.
Samantala, isa sa ilalim sa General Community Quarantine ng buong National Capital Region kasama ang mga karatig lalawigan ng Bulacan, Cavite, Laguna at Rizal na tatawagin bilang NCR Plus sa loob ng 2 linggo. Magsisimula ito ngayong araw, March 22, 2021 hanggang April 4, 2021. Yan po ay base sa pinakahuling resolusyon na inilabas ng Interagency Task Force Against COVID-19 kahapon bilang tugon sa patuloy na paglobo po ng mga kaso ng COVID-19 sa bansa. Dahil dito magiging isang travel bubble sa loob ng 2 linggo ang NCR Plus. Ibig sabihin po, hindi pwedeng pumasok at lumabas mula sa travel bubble na ito ang mga may non-essential travel. Tanging ang mga authorized persons outside of residence o upper lang po ang papayagan. Magpapatupad din po ng 10 p.m. to 5 a.m. common curfew sa buong NCR, Bulacan, Cavite, Laguna at Rizal. Para malaman ang mga karagdagan detalye sa bagong paghihigpit na gagawin sa mga apektadong lugar na yan, makakausap po natin si DILG spokesperson Undersecretary Jonathan Malaya. Good morning po, Yusek.
Yes, magandang umaga, Yusek Rocky.
Yusek, kahapon nga po inanunsyo na yung pagkakaroon ng GCQ bubble sa NCR at 4 na probinsya na nakapalibot dito. At ang highlight dito ay yung pagkontrol sa galaw ng mga tao. Unahin muna natin, sino lang po daw ang papayagan lumabas ng bahay?
Opo, Yusek Rocky, ang dahilan po nitong paghihigpit natin ay para nga po hindi na kumalat pa ang COVID-19. So gumawa po ang ating pamahalaan ng tinatawag na travel bubble o itong NCR plus neighboring provinces o yung matatawag po nating Mega Manila area. So hindi muna po makakalabas for 2 weeks or makakapasok ang mga taong walang essential travel except yung mga essential workers na makapagpapakita ng ID nila na sila ay kailangan gumalaw dahil sa trabaho, yung mga health and emergency frontline services personnel, mga taong gobyerno na may essential na ginagawa, mga kumpanya na humanitarian ang ginagawa, persons traveling for medical or humanitarian reasons, yung mga papunta po sa airport para bumiyahe papunta sa labas ng bansa, and yung mga pauwi sa Metro Manila galing sa isang leisure activity. And of course, yung mga returning overseas Filipinos and overseas Filipino workers. So, namin ko po, lahat po ng hindi pasok dito sa pamantayang ito, gaya ng lalabas para sa leisure or lalabas para sa travel and tourism purposes, ay hindi po pinapahintulutan ngayon, hindi po kayo papayagang lumabas sa mga checkpoints at hindi rin po kayo makakalabas sa ating mga airports and seaports as well.
Opo, magsaset up po ba ulit ng mga checkpoints kada barangay o kada kalsada para po tiyaking walang makakalusot na hindi authorized person outside residence? At ano lang po yung need na ipakita ng mga lalabas ng kanilang mga bahay?
Hindi po tayo maglalagay ng mga checkpoints sa mga barangay o sa loob ng Metro Manila for purposes of the travel bubble. Ang mga checkpoints po natin, Yusek, ay nasa mga boundaries ng Bulacan papuntang Pampanga, sa boundary ng Rizal papunta sa mga karatig probinsya, sa boundary ng Cavite and Batangas at yung mga boundaries ng Laguna papunta naman sa Quezon, no? So, nandyan po mga 20 po yan na tinatawag nating quarantine control points. Kagabi po ng alas 12 ng ating gabi ay nakapag-set up ng ating Joint Task Force COVID Shield sa pamumuno ni General Cesar Cosorn Binag, no? Yung mga checkpoints pong ilinalagay natin sa Metro Manila ay hindi for purposes of the travel bubble, yun po ay for purposes of the curfew restrictions natin. Nagtalaga po tayo ng mga 10,000 kapulisan sa buong Metro Manila at karatig lugar para po ma-implement ng maayos yung ating curfew na nagsisimula ng alas 10 hanggang alas 5 ng madaling araw.
Opo, sabi po sa resolution, senior citizens daw po are allowed kung may importanteng gawain, katulad po na mag-exercise at mag-engage po sa non-contact sports. May limit ba yung layo na pupuntahan nilang lugar? How do we enforce na hindi po maaabuso itong exemption na ito?
Opo, pwede nga pong lumabas para mag-exercise ang ating mga senior citizens or kaya naman bumili ng pagkain or bumili ng mga gamot sa Mercury Drug, for example, o sa mga butika natin. Ngunit doon po sa mga outdoor exercises, kailangan malapit lang po sa kanilang tinitirhan. Kasi po it will defeat the purpose of itong ating gagawin kung sasabihin natin na yung taga Las Piñas ay dadayo pa ng Luneta o yung mga taga Parañaque ay dadayo pa ng UP campus para mag-exercise lamang. Doon po tayo mag-exercise sa mga malalapit na lugar sa atin, no? Na open air. Doon po tayo mag-exercise. Kung kayo po ay nakatira sa subdivision, doon sa inyong clubhouse or any open area. Kung kayo naman po ay hindi nakatira sa subdivision, kahit po saang lugar, pero wag na po tayong dumayo pa sa kabilang bayan para lang po mag-exercise because it will defeat the very purpose of yung ating stay-at-home policy.
Opo, paano daw po yung nasa public transport? Iisa-isahin ba ulit yung route purpose ng travel nila kapag dumaan sa border?
Opo, for purposes of implementing the travel bubble, lahat po ng papasok at palabas ng Metro Manila na nakasakay sa mga pribado or pampublikong sasakyan ay i-inspekin po yan ng ating kapulisan. So maghanda na po tayo ng mga ebidensya na tayo ay pasok doon sa IATF Resolution number 104. Ipakita po natin sa mga pulis na ang ginagawa natin ay essential work or essential function. So pwede pong pababain ang lahat ng nakasakay sa mga public transportation. Yun naman pong mga nakasakay sa pribadong sasakyan ay kailangan lamang buksan ng kanilang mga bintana at isumite sa ating kapulisan yung ating mga dokumento magpapatunay na ang ginagawa natin ay essential at hindi leisure or tourism purposes.
Opo, Yusek, unahin ko na itong tanong ni Pia Gutierrez ng ABS-CBN. Ano po, LGUs outside the bubble have implemented their own versions of quarantines. Example daw po, Pampanga has imposed house quarantine province-wide. Is this allowed? Hindi ba dapat may approval ito ng IATF?
Okay, hindi pa po maliwanag sa akin, Yusek, kung anong ibig sabihin ng house quarantine ng Pampanga. No? I would need more details about that. Pero kung ang sinasabi ng Pampanga ay yung kanilang mga kabataan, no? Yung 18 and below, and 65 and above have to stay at home, ay wala naman po ako nakikitang problema dyan because that would be consistent with the IATF Resolution 104. Ngunit kung pinagbabawalan po lahat ng tao na lumabas at makapagtrabaho o kaya naman ay mag-access ng essential services o kaya naman gumawa ng isang bagay na with relation to livelihood or work, ay yan po ay hindi po yan consistent sa IATF Resolution. And we would request the Pampanga provincial government to withdraw that policy.
Tanong po ni Bea Bernardo ng PTV, ang non-essential travel po ba like a staycation within the NCR Plus bubble ay papayagan o hindi?
Okay. Pwede po yung mga staycation within Metro Manila dahil nga po ngayong Holy Week, no? Marami na pong nagplanong lumabas. Ngunit dahil nga po dito sa ating imposition of travel bubble, hindi na po kayo makakalabas. Ngunit, remember, meron po tayong prohibition on any form of mass gathering. Ibig kong sabihin, kung mag-staycation po kayo lang pong immediate family. Kasi po, let me give an example, Yusek. Lalabas ng Metro Manila, pupunta ng Laguna. Allowed yun because we are one contiguous area, NCR+. Pero 30 naman kayo at pupunta kayo sa Calamba para mag-swimming doon sa mga, or sa Los Baños para mag-swimming or sa Pansol, no? Pinagbabawal po yan. Hindi po yan pwede. No? It must only be your immediate family. Dahil hindi nga, pinagbabawal nga po ng mahigpit yung public or mass gathering. Especially po yung mga indoor gatherings, Yusek. Kasi di ba kita natin, ang hawaan ngayon, household level. So any form of indoor gatherings, especially yung more than 10, ay ipinagbabawal po natin.
Opo. Question from Jackie Madabat ng ABS-CBN, what is the protocol if a passenger daw po tests positive for COVID-19 at a transport hub, RT-PCR and antigen?
Okay, hindi po maliwanag sa akin yung tanong kasi if this relates to travel to a province for tourism purposes, pinagbabawal na nga po natin yan. Ngunit kung meron pong apor na pumunta sa isang probinsya and the province requires RT-PCR test, kung negative po siya at wala po siyang sintomas, papapasukin po siya ng probinsya. Ngunit kung siya po ay nag-positive sa antigen or sa RT-PCR test, he will have to be quarantined by the LGU of destination. So, doon na po siya muna magka-quarantine hanggang gumaling siya doon sa LGU na kanyang pinuntahan.
Mula pa rin po kay Jackie Manabat, some of those who tested antigen positive were asked daw po by some barangays to take the taxi from the airport. Allowed ba to? At if yes, bakit daw po?
Yusek Rocky, saang nangyari ito? No? Kasi this may be Metro Manila, this may be Cebu, this may be Davao. So, I'd like us to ask Jackie for additional information para mas masagot ko ng tama yung tanong. Kasi nag-iba-iba na kasi yung rules natin for Metro Manila at iba naman yung pulisiya natin outside of the Greater Manila area.
Opo. Tanong pa rin po ni Jackie Manabat, who will determine daw po if the travel is essential and non-essential?
Well, unang-una, the person himself, no? You will know if your travel is essential because if you are doing it for purposes of work, no, you are an architect and or you are a logistics handler and you have to leave Manila para maghatid ng mga goods, no? Isa kang agriculture, you're related to delivery of food into and outside of Metro Manila, no? You are working for Mercury Drug and you are delivering drugs outside of Metro Manila or to Metro Manila. Lahat po yan essential because those are work-related. Pero kung uuwi po tayo sa ating mga probinsya para magbakasyon, that is not work. That is not essential work. That is leisure and that is already travel and tourism. So it will be you at the beginning, but if you will insist, it will now be the airlines for those flying outside of the country or the agencies of government at our airports. It will be the seaports, yung ating mga the different sea companies, no, travel companies for sea travel, and it will also be the police officers manning the checkpoints who will determine if you are undertaking essential travel.
Opo. From Raymond Tinasa ng Bombo Radio, kung bubble GCQ ang NCR, Rizal, Laguna, Bulacan at Cavite, meaning pwedeng makabiyahe, walang travel restriction within sa bubble area, except kung lalabas sila sa Batangas and Pampanga?
Yes, tama po yan. But Yusek, it has to be read in conjunction with the prohibition or encouraging the public to stay at home. Kasi unang-una, there's a variant spreading in Metro Manila. At ayaw natin ng super spreader events na magpapataas pa ng 7,500 to baka umabot pa ng 9,000.
Taliwala sa nahiagumang pandemya ning atong nasud karon, naninguha ang nasyonal nga pangagamhanan nga ipaabot sa kadaghanan ang mga tubag sa nagbaha nga